After watching this video, you will know the do's and don'ts of hearing aid care, be able to carry out daily care of your hearing aid, and be able to carry out battery replacement.
This hearing aid is indeed an amazing device, but it's so small. Is it hard to maintain?
Don't worry, it's simple.
What should I do?
It is okay, we will show you.
There are a few do's and don'ts for hearing aids. Do not get it wet, as hearing aid is not waterproof. Remove it before showering. Remove it before sleeping. Do not drop it. Do not use hairspray on it. Daily care. Take off your hearing aid when not in use. Remember to open the battery compartment to switch off the hearing aid to maximize the battery life. Clean it with a dry cloth to remove any earwax, sweat, and other foreign material on the hearing aid. Brush the soundbar of the hearing aid. Ensure the soundbar is facing downwards during cleaning to prevent any earwax from entering the soundbar. Put the hearing aid into the hearing aid container for safekeep. The hearing aid container has a drying capsule to absorb moisture. Change the drying capsule once its color has changed. If you are not sure, change the capsule once a month. It is important for the hearing aid to be dry and the drying capsule to be fresh. This prevents your hearing aid from corrosion. Changing of battery. Depending on the battery size and your usage, the hearing aid battery needs to be changed every 10 to 14 days. You can buy the battery from the hearing clinic and some pharmacies. Open the battery compartment gently. Insert a new battery into the compartment. Ensure that the positive sign or the flat surface is facing up. If the direction is wrong, the compartment will not close properly. Do not close the compartment forcefully. Close the battery compartment completely to turn on the hearing aid.
Wow, that sounds simple. I believe I can handle it.
Yes, it is definitely within your means. If any problem, you can always make an appointment with your audiologist.